name is Kaleigh. I'm going to be your nurse today. I'm here to do an assessment on you. Is this an okay time?
Sure.
Okay, I'm going to go ahead and wash my hands. I've shut the door for the patient's privacy. So I'm going to go ahead and get your name and date of birth as I look at your wristband.
Barbara Gordon, and it's 6/23/70.
Okay, that's what I have too. So I'm going to go ahead and do a chest, lung, cardiac, and abdominal assessment on you.
Okay.
So first we're going to go ahead and get your vital signs. What's bringing you in today?
Oh, this is just an annual checkup.
Okay. First we'll do your blood pressure. We'll use your brachial artery for that. Patient's blood pressure is 124/72. So now I'm going to go ahead and assess your pulse and respirations. So just breathe normally. Alright, respiration 16 and pulse is 62. So now I'm going to get her pulse oximetry using this little pulse oximeter. And it's going to be 97% on-room air. So now let's go ahead and get your temperature real quick under your tongue. Alright, 97.7 is the temperature. I'm going to write that down real quick. Alright, and are you in any pain today?
I have a little pain to the push, I guess, kind of a bruising up in this area, but only when it's pushed, and it's only slight.
Okay. So on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what would you give the score of that pain right now?
3.
Okay. So then we'll just make sure not to press on that area and make it any worse than it is now.
Okay.
But I'm going to go ahead and inspect your chest and take a look at your lungs as well. So I've noticed that my patient's AP transverse diameter is 2 to 1, which is normal. I've also noticed while assessing and talking to my patient that her breathing is even and equal bilaterally, chest rise and fall symmetrical. So now I'm going to go ahead and have you lay down flat for me.
Okay.
Get all this stuff out of the way. And I'm going to palpate your chest. This is just to feel for any abnormal vibrations, so just breathe normally for me. Alright, no tactile firmness noted. Now I'm going to go ahead and listen to your lung sounds. We'll listen to the front. Just breathe in normally for me. Actually, take a deep breath for me every time I move my stethoscope. I would usually do stethoscope to skin, but because my patient is in a video, I'd like to maintain her privacy, and I'm doing it over her clothing at this time. under the arms. Alright, now we've listened to the front. We'll go ahead and have you sit up and we'll listen to the back as well. And we'll do the same thing, just take a deep breath every time I move my stethoscope. Okay. Okay, lung sounds are clear and equal bilaterally. No wheezes or crackles noted on auscultation. So now I'm going to go ahead and visualize the point of maximal impulse. Usually this would be at the 5th intercostal space on my patient for 5 and at the mid-clavicular line, so it would be right under the breast area right here. It's very hard to visualize with her shirt on. I'm going to go ahead and have her lay back flat for me. I'm going to try and visualize it while she's laying flat, as at the 1, 2, 3, 4, 5th mid-clavicular line, so right here. It can be palpated, but I can't visually see it moving with her chest and bra on, or her shirt and her bra on. So now I'm going to go ahead and assess for jugular venous distension. I'm going to have you raise up slowly for me with your neck extended like that. I'm going to look at your neck veins as you do. Keep coming, keep coming, keep coming. No JVD noted at 30, 45, or 90. You can relax back. Okay. So now that I've already inspected her chest and her heart, I'm going to listen. I'm going to go ahead and palpate her pulses, and then we'll listen to her heart sounds after. So if you'll sit up for me on the edge of the bed. First, I'm going to palpate the carotid pulses. Do them one at a time. 2+ and strong. We'll do this side. You can breathe normally. 2+ and strong. Okay, now we'll go ahead and I'm going to feel the brachial pulses. I've already palpated the PMI earlier as I was trying to find it during the inspection. Brachial pulses are equal bilaterally, 2+ and normal. Now the radial pulses. Radial pulses are 2+ and equal bilaterally. If I could have you just lean back for me, I'm going to assess the femoral pulses in her groin real quick. Femoral pulses are 2+ and equal bilaterally. If I could have you lay flat like it's a bed again, and I'm going to assess the pedal pulses now. All right. Pedal pulses are 2+ equal and strong bilaterally. Now I'm going to go ahead and assess the posterior tibialis pulses, which are 2+ and equal bilaterally. Now I'm going to go ahead and do capillary refill on her toes, which is less than 3 seconds and normal. Now I'll go ahead and wash my hands off to the side here, and then I'm going to check the capillary refill in her fingertips, which is less than 3 seconds as well. So now that we've palpated all of the heart areas, I'm going to go ahead and auscultate all the heart sounds. And you can just keep laying flat for me. Okay. That's fine. Alright, so the first one is going to be the pulmonic area, which is at the 2nd intercostal space on the right sternal border. I'm going to listen first with the diaphragm and with the bell. Okay, now to the second heart sound, which is going to be the pulmonic area. It's the second intercostal space on the left sternal border, so I'll listen to this area now. And with the bell. This is also where S2 is heard the loudest. Now I'm going to go ahead and listen to the tricuspid area, which is going to be at the fourth intercostal space, and it's on the left sternal border as well. And with the bell. Now I'm going to listen to the PMI again, which is also the mitral valve location. It's at the fifth intercostal space and the midclavicular line, which is right underneath the breast. It's going to be where S1 is heard the loudest. And with the bell. Okay, now I'm going to listen to the PMI as I assess the radial pulse. And they are beating equal, 2+ on the radial pulse. So now that I've listened to all of the heart sounds, I'm going to go ahead and inspect the abdomen. I'm going to just lift up for a second. Abdomen is round, non-distended. There is one scar on this area and one on the belly button from a previous gallbladder surgery in 2018 that my patient had told me about previous to the video starting. We've also got skin that is warm, dry, normal color for this patient's ethnicity. I have not noticed any bruising, masses, or hernias. Now I'm going to go ahead and ask you if you have any abdominal pain today and show me again where it is.
It's only to the touch, and it's more in this area.
Okay, that's fine. So I'm going to go ahead, and I'm not going to palpate that area because I don't want to cause any more tenderness since it's already there. But first thing I'm going to do is I'm going to listen to your bowel sounds. So let's do that first. Okay. So I'm going to start with the left lower quadrant. I've separated the abdomen into 4 quadrants with a horizontal and vertical line at the umbilicus. So we'll start here and move clockwise. Alright, bowel sounds heard in all 4 quadrants. I'm going to go ahead and listen now for vascular sounds. This is going to be the aortic, or the first 2, then the renal arteries, and then after that the iliac arteries, and then the femoral arteries. All are kind of closer to the mid of the abdomen, and the first 2 will be in the upper quadrants. So first we're going to listen to the left aortic artery. And I'm going to listen with my bell side. No bruise noted. Now the right aortic artery. No bruise noted. Now the right renal artery. No bruise noted. Left renal artery. No bruise noted. Now I'm going to listen to the left iliac artery. No bruise noted. The right iliac artery. No bruise noted. And now the right femoral artery. No bruise noted. And the left femoral artery. No bruise noted there either. Now that I've listened to the abdomen, I'm going to go ahead and percuss. This is to feel for any abnormal sounds that could be created by bouncing off of organs. So I'm going to start with my left hand down. We'll start in the left lower quadrant and move out. Dullness noted, tympany noted over all of bowel sounds. So now I'm going to go ahead and percuss for the liver. Dullness noted over the liver. Dullness noted over the spleen as well. So now I'm going to go ahead and palpate the abdomen. Show me again where the tenderness was. Okay, so I'm going to avoid palpating that area. Let's start with light palpation in the left lower quadrant. Feeling for masses, hernias, anything abnormal, any distension. The light palpation is within 1 centimeter. And no masses or abnormalities felt, so I'm going to deeply palpate, which is about 2 centimeters. Alright, no masses or abnormalities felt on deep palpation either. I'm going to go ahead and feel for the patient's liver border. So I'm going to put my hand underneath of these right ribs, and I'm going to feel with my index finger the tip of the liver, which is smooth and firm. I'm going to feel for the spleen on this side and see if I can't find bottom of the rib cage. Pull up. I cannot palpate for a spleen, so I'm going to have her sit up on the edge for me. We're going to do one last test that is going to be for CVA tenderness. If you could face that way a little bit. I'm going to put my fist here over the flank, and then I'm going to tap on my finger. Do you feel any tenderness?
No.
Okay. And the other side? Any tenderness? No. Okay, so CVA tenderness is negative. My patient has stated that she has pain to palpation over the epigastric region. It is 3 out of 10. It's a dull bruise feeling, and we did not palpate that area to not make anything worse that may be going on there. But I'm going to go ahead and interview my patient off screen and finish the assessment. The physical part is complete, so thank you for letting me assess you.
No problem.